Hello, I am Dr. Jazeer once again, and we are going to continue our discussions about the INICET past previous papers. Okay, now let's start with the first question once again, and that is, desmosomes are abundant in which of the following layers of the skin? Now an image like this is given and they have labeled it as A, B, C, D. Now what is A? A is the outermost layer of the epidermis, that is the stratum corneum. So B is going to be stratum lucidum, C is going to be the stratum granulosum, and the next layer, that is D, that is marked, is going to be the stratum spinosum. So what comes below spinosum? The stratum that comes below spinosum is stratum basale. Okay, so out of all these layers, where do you find desmosomes most evident? So desmosomes are most clearly seen in the thickest layer of the epidermis, that is the stratum spinosum. So that is why this layer is also called as the prickle cell layer. So the right answer here would be what is labeled as D, that is stratum spinosum. So now let's go to the next one. What is shown in this following image? So that is a question and the image like this is given. So what can you see in this image is that there is a small elevation over the skin, and if you closely examine, it is having a shape like that of an alphabet S. So S shaped elevation over the skin that is usually seen. So what is the options given? The options are scabies, ichthyosis, contact dermatitis and urticaria. Pretty easy to rule out, because in which disease do you find these kind of an S-shaped lesions beneath the skin? That is called as the burrows, and burrows is seen in scabies. So the answer here would be scabies. So now let's go to the next question. The structure made of dense irregular collagen is. So where do you find dense and irregular collagen? The options are ligament, dermis, tendons and bones. So the answer here would be dermis, because in dermis you will be able to see dense and irregular type of a collagen. Now tell me, where do you find dense regular collagen? The options being the same. So dense and regular collagens is seen in tendons, whereas dense and irregular collagen is seen in the dermis. So that is the right answer for this question. So now let's go to the next one. The question is, a patient presented with hair loss and itching of the scalp along with mild discharge. So there is hair loss, there is itching and there is a discharge. So which of the following is most useful for diagnosis? So they are going to ask you about the dermatological investigations that has to be done for the diagnosis of this patient. So the options are Sang smear, Gram stain, slit skin smear and KOH mount. So what do you expect when a patient complains to you about a itchy scalp along with some hair loss and with some mild discharge? The first thing that should come to your mind is some kind of a superficial fungal infection. Yes, it should be Tinea capitis. So in Tinea capitis, all these types, be it favus or chirion or grey dot or black dot or grey patch, in all these things, the first investigation that you would do is a potassium hydroxide mount, that is KOH mount. So the right answer here would be option D, that is KOH mount. Okay. So now let's go to the next question. So identify the condition which is given in the image which is present from birth. So image like this is given. So what do you find in this image? You can see that there is a blackish mole, isn't it? So this black colored mole that is pretty bigger in size and with some hair follicles that is also present over this mole. So this is a typical presentation. So what is the right answer? Is it an epidermal verrucous nevus? Is it a congenital melanocytic nevus? Is it melanoacanthoma or malignant melanoma? The right answer would be anything that is black in color, okay, dark black in color with some hair that is growing over it. So this is called as a congenital melanocytic nevus. So the right answer is congenital melanocytic nevus. Please remember that giant congenital melanocytic nevus is a precursor for malignant melanoma. So the giant one where the size is very big. Now let's go to the next question. Which nerve is biopsied for the diagnosis of neuritic leprosy? Options are median nerve, superficial branch of radial nerve, ulnar nerve and lateral popliteal nerve. So as we all know that nerve biopsy is the gold standard investigation for the diagnosis of neuritic leprosy. But the question is, which nerve are you going to biopsy? See, it is prudent to biopsy a branch of a sensory nerve for the diagnosis of neuritic leprosy. So the best option here would be superficial branch of radial nerve. So that is the right answer in this case. Okay. Now let's go to the next question. Like, which component of cement causes allergic dermatitis among construction workers in India? The options are cobalt, nickel, iron and chromate. So which among all these things is going to cause this kind of an allergic contact dermatitis or occupational contact dermatitis in construction workers in India? So the main culprit in cement, please remember, is going to be potassium dichromate. So chromate, that is option number D, is going to be the right answer. Potassium dichromate, which is present in cement, is the most common cause of occupational allergic contact dermatitis in the construction workers. Okay. Now let's go to the next question. Which of the following drug is being used in the treatment of Tinea cruris is for which widespread resistance is found to be developing? So the question says you are using some antifungal agent for the treatment of Tinea cruris, but for which among the following drugs do you find increased cases of resistance? The options are itraconazole, grisofulvin, terbinafine and voriconazole. So among all these antifungal agents, the one that is developing a lot of resistance recently due to overuse or misuse is going to be terbinafine. So there has been studies which shows that terbinafine shows excellent results against Tinea cruris because Tinea cruris is a dermatophytic infection and the most common causative organism is going to be Trichophyton rubrum, and terbinafine usually responds very well when it is prescribed for Tinea cruris, but recently a lot of resistance has been reported on due to this overuse of terbinafine for the use of for the management of Tinea cruris. So that is all about this question. Now let's see the next one. A mother has a pearly white papule on her forehead, which her infant also develops. What is the cause? The options are HPV, adenovirus, pox virus and herpes virus. So you can see this image here. So what you find in this image is a pearly white papule, and if you closely examine, you can see that there is a central umbilication as well. So pearly white papule with a central umbilication spreading from one person to the other due to a close contact. So that means this is typical for molluscum contagiosum. So what is molluscum contagiosum? Molluscum contagiosum is a type of a pox virus. So the right answer here would be pox virus. So with this we'll conclude this lecture, and in the next episode we shall come up with remaining questions in the INICET previous papers. Thank you so much.